Up next on The Reveal.
They took him to parties.
Parties led to drugs. The addiction led him to this rehab facility.
I watched two people dig into their savings, thinking that we're going to help Chad. The money's gone and Chad's not fixed.
Medical mistakes.
I think of this as a plane crash. Everything that could go wrong went wrong.
We investigate claims a major hospital's electronic medical record system is potentially putting patients' lives at risk.
Thank you.
We did not assign a sex at birth.
And a raising baby, a gender-neutral baby.
We're not forcing them to be one gender or another.
The Reveal begins now with investigators Faith Abube and Brendan Keefe.
Welcome to The Reveal, a show where news is made.
Drug overdose deaths have now outpaced car crashes in the state of Georgia. In 2017, there were 1,500 deaths, and drug treatment facilities are struggling to keep up. And that's created a market where unlicensed facilities are operating with little to no oversight.
He's my son.
A rising baseball star in high school, Luana Wheaton says her son was popular with the older kids.
They took him to parties.
Parties led to drugs.
It's been heart-wrenching. It's been tough. Never, ever, ever, ever imagined this.
When it became clear Chad would need professional help, the family borrowed money to send him to Discovery House.
The Discovery House approach to recovery is unique.
They assumed if the drug treatment program was open, it must be licensed.
They detox him, and he gets massages, and there's meditation, and there's Tai Chi.
But Wheaton says after 3 weeks in the program, Chad had yet to receive many of those services.
He was bored to tears.
While the rehab facility rents traditional apartments to house clients, she expected structure to keep clients away from drugs. Chad had a roommate.
Well, then they brought in a third guy, and he was just whacked out.
He wasn't clean.
No, he wasn't clean.
But when Wheaton asked why the program wasn't living up to its promises, she was told it was her son's fault.
Chad's uncooperative. He's belligerent. He walks in and out of here like he owns the place.
Would not even process it.
Daryl Hall, the man who founded and manages Discovery House, didn't want to talk about Chad's case specifically. The family did file a civil lawsuit, and he has been court-ordered to refund part of their fee.
You know, all that sort of history now.
But Hall did welcome the opportunity to defend his program.
You can walk into the best restaurant in Atlanta, and you can be the one that, the steak was undercooked, and the waiter took forever to get to you. But you don't rate the whole restaurant on that one steak meal.
Hall admits he ran Discovery House for 7 years without a license. He did try to get one in 2014, but the Department of Community Health, or DCH, denied his application. Still, Hall kept his facility open without any state regulation or oversight. 8 months later, a client died of a drug overdose. In his room were prescription pill bottles from people no one claimed to know.
I think that's the only overdose death on site, actually.
But it's not. 7 months later, another client died of an overdose. And 2 months after Hall received his third letter ordering him to close the facility, a staff member died of a drug overdose, the needle still in his arm when Hall found him.
He was a complete shock. He had been clean and sober for a while. For years, a couple of years, I think.
The string of deaths prompted Duluth police to file their own complaint with DCH. The department finally investigated 6 months later.
You received one cease and desist letter, you received another cease and desist letter, you received another cease and desist letter, you received another cease and desist letter, but you never stopped. Is what you were doing, in your mind, more important than following the law?
It's very important for me to follow the law. The letter of the law is the point.
Hall says it was DCH that misunderstood his program and insisted on a license he legally didn't need. And because his name was associated with Narconon, a drug treatment program banned from operating in the state, his name had been blacklisted. But in the summer of 2018, he did finally get that license under the name Recovery Works.
We have 2 medical doctors and a psychiatrist that operates as a clinic. They just went in, took my name off of it, and absolutely they licensed the program.
So it really wasn't the program that they had a problem with, it was you.
It's personally me.
Instead, Hall used the name of one of those doctors Jeffrey Rausch, a recovering drug addict actively receiving treatment himself. According to the Georgia Composite Medical Board, Rausch was convicted 3 times for drug possession and spent 6 months behind bars. While not unusual for a professional with a history of addiction to later treat others, at the time DCH agreed to license the program, Rausch's medical license was still on probation.
And of course, Tara and Melanie from the House and the Senate.
Commissioner, could we talk to you for a few moments? That's my voice as I tried to talk with Commissioner Frank Berry as he left a meeting here at the Capitol. But his staff initially blocked me here at the top of the stairs.
I think my reporter has a few questions for you.
I wanted to ask him why DCH repeatedly sent cease and desist letters to the program without ever actually enforcing those letters, or why they suddenly had a change of heart. His only response:
We always believe in helping people get the care that they need. Thank you.
It infuriates me.
Wheaton says after that meeting with Discovery House, her mom borrowed even more money to enroll Chad in a different rehab program. And for the first time, there is hope.
And does it seem different?
Oh my gosh.
How does this one seem different?
Because I see him better. And I see him go to meetings every night.
Wheaton says our state has to figure out how to get it right. It has to be more aggressive, shutting down unlicensed facilities, or actually help them deal with the deficiencies so they can operate. She says there is just too much at stake.
Life, sobriety, future.
Dr. Rausch has since had his probation on his license lifted, and again, Discovery House, doing business under the name of Recovery Works, is licensed. Now, while I was doing my research, I did talk with several people who support this program, including the mother of one of the men that died with the drug overdose.
Rebecca, why isn't the state more aggressive shutting down these unlicensed facilities?
And that's been my driving question all throughout this. The state simply says it's following the guidelines set by lawmakers.
So do they feel there's a problem, and do they want to do more?
Well, if you were to take a look at their budget, the answer would be no. They have 5 surveyors to cover the entire state that's to handle licensing as well as any complaints that come in. They've received no additional funding in the past 5 years, and by their own admittance, they haven't asked for any.
Next on The Reveal.
You go to the doctor when you're sick, and you get answers, you hope.
A grandfather dies from a deadly blood infection. Why the family blames his death on a hospital's electronic health record system.
It's a known problem and something that's easy to fix, and that hasn't happened. And that's the scary part.
If you have a news tip or a comment on one of our investigations, email us at thereveal@11alive.com.
A new lawsuit claims one of Georgia's largest hospitals is using an electronic medical record system, potentially putting patients at risk. The allegation? A flaw in its system that could allow critical blood test results to go unchecked. One family says it cost them their grandfather's life.
And I used to get up and dance with him.
Yeah, it's a good one.
Surrounded by grandchildren, Veronica Long flips through pictures of a man they all remember as the life of the party.
He was a dance machine. He really was. He loved music. And he was the life of any party. Wherever he showed up, there was a party.
More than 20 years ago, 11 Alive profiled Long and her husband Rudolph as grandparents raising more than a dozen children.
Someone to love them and show them love every day in a stable home. Okay, you're doing all right.
So it just became a circus, and it's just something that we did, and we enjoyed it.
Yes,
Today, Long is now raising great-grandchildren, but doing it alone. In March 2016, her 65-year-old husband died from septic shock, a type of blood infection, and they blame Wellstar Hospital in Cobb County for allowing it to happen. According to a pending lawsuit, it started with a visit to the emergency room. A Wellstar doctor ordered a blood culture, a test to determine if Rudolph had bacteria in his blood. The results came back the next morning in a software program which tracks patient medical records, testing gram-positive for cocci and chains, a blood infection Wellstar's own policy identifies as a possible life-threatening situation. Over the next week, Long returned to the ER 3 additional times, his condition worsening. During every visit, medical staff had access to Long's blood culture results.
Correct.
But according to numerous video depositions with doctors, all of them say they did not know the test results existed.
I do not think that information was known at that point in time.
So I had a long conversation with Mr. Long, but I didn't know the blood culture thing.
Each medical provider who treated Long claimed WellStar's electronic medical system doesn't alert them when critical lab results are available.
Are there any kind of alerts that it give you automatically?
In the context of blood cultures, I haven't seen any specific pop-ups.
I was not aware. I did not have that information.
By the time hospital staff found the results, it was too late.
You go to the doctor when you're sick, and you get answers, you hope. And this time we didn't get any answers. We just kept getting sent back home.
It just wasn't caught.
Natalie Woodward is Long's attorney.
I think of this as a plane crash. Everything that could go wrong went wrong.
What's most concerning to Woodward is that she says WellStar knows a flaw in its medical record system exists, but has done nothing to change it since Long's death. In depositions, doctors confirmed it.
Is that same practice the same today as it was in February 2016?
Yes.
It's a known problem and something that's easy to fix, and that hasn't happened. And that's the scary part.
WellStar declined interview requests, but did email us saying we continually assess our processes and look for areas of improvement. The hospital also claimed its doctors are supposed to know how to use its electronic medical record system, writing in part, "We require that medical staff members demonstrate their proficiency."
Independently recall.
But in numerous video depositions, WellStar's own staff claim either they did not receive or remember the hospital providing training related to accessing critical lab results.
Have you ever had any kind of training while you were at WellStar about WellStar's policies and procedures?
No.
Have you ever had a copy of the WellStar policies given to you for your review? Not that I remember. So there's a document that says how something's going to happen or supposed to happen that no one's ever seen, and that they don't even understand the process or how it's theoretically supposed to work.
WellStar's response to those claims, because this is a legal matter, we cannot comment further at this time. WellStar will continue to vigorously defend itself in court. In response to the lawsuit, the hospital also denied all malpractice claims related to Long's death. A man so many relied on who died from what his family believes was a preventable medical mistake.
If you could say anything to WellStar, what would you say to them?
That they took a good man away. We lost the life of our party.
So Andy, to be clear, WellStar isn't saying if they're going to fix this or not.
That's correct. They did not say yes or no when we asked them whether they plan to change any of their policies and procedures, only to say that they continually look for ways to improve themselves. They also said that the software that they use to track critical lab results is used in the top 20 U.S. hospitals. We'll keep you updated.
Coming up,
You're doing so good.
we explore why more and more families are choosing to raise a genderless baby.
We didn't want Sparrow to grow up in an environment devoid of gender. We want them to get to experience all genders.
In 1965, Mary Shotwell Little vanished from Lenox Square Mall. Less than 2 years later, Diane Shields was found brutally murdered in the trunk of her own car. Investigative journalist Jessica Knoll is working to uncover whether these cases are connected in her 7-chapter podcast series, 5 Roses.
Many parents find out the sex of their child before the baby is born. Others opt for the surprise, waiting to hear it's a girl or it's a boy.
However, some families are exploring another option, raising a gender-neutral child.
Revealing the sex of your unborn baby has become a little silly. Huge gender reveal parties are popular, with themes like touchdowns or tutus, and rifles or ruffles, indicating whether you're having a boy or girl. Yes, even this, an alligator chomping into a watermelon and blue jello spilling out. A proclamation to the world, it's a boy.
See, it goes right in.
But for some families,
oh, I love this. Thank you.
the gender reveal won't happen anytime soon.
We did not assign a sex at birth, which means when they were born, they had genitals and we know what they are. We just chose to acknowledge that those genitals don't indicate anything about gender.
Meet Sparrow, a smiling, curious, adorable 11-month-old baby.
Is this a baby?
Your next question might be, is Sparrow a boy or girl?
Can I see Elmo?
The answer, to be determined.
My own mother did not know Sparrow's genitals for the first 3 months, even though she was living with us at the time.
You're doing so good.
Sparrow's parents decided to raise their baby gender neutral, meaning Sparrow will decide gender when older. Even Sparrow's birth certificate says sex unknown.
We are in no way prohibiting Sparrow from having a gender, and we're not forcing them to be one gender or another.
Here comes the baby.
Ari says the family was inspired to raise Sparrow without a known gender after their older child, Hazel, discovered gender around the age of 4.
Hazel, what do you say when someone asks you if you have a little brother or sister? How do you respond?
I say I have a little sibling because they're my little sibling, not sister or brother.
Have any of you slipped up?
No one here in the house has. We didn't want Sparrow to grow up in an environment devoid of gender.
Because that's not real life.
Yeah, it's not real life. We want them to get to experience all genders. So like them going out in public and getting treated like a girl and then getting treated like a boy and then getting treated like someone you can't tell shows them what the diverse options are.
Sparrow's family isn't alone. A closed Facebook group called Parenting Babies has roughly 350 members.
Now, what if Sparrow says to you in the coming years, am I a boy or a girl?
I would tell them that they're the only one who gets to decide that I can't know that. Well, do you feel like a boy? Do you feel like a girl?
So let me put you on the spot with this question. So I told you I have a daughter, Finley.
Yeah.
The walls in her nursery are pink.
Yeah.
Do you think I'm nuts?
No. I think you're following a comfortable social narrative.
As for Sparrow, it's wait and see. A gender reveal Ari believes is worth the wait.
There's no way this can go wrong. People will be like, oh, well, the child will be confused. No. If gender is really something in you, then no one's going to change that.
And as you can imagine, this investigation has generated a national conversation. Here's Liz Crawford with more.
Now, you have varying degrees of gender-neutral parenting. You have some families, like Sparrow's, choosing not to disclose the sex of their baby. But then you have other families who are just choosing to let their kids play with whatever toys they want and wear whatever color they want. When this story first aired, we got a lot of reaction on social media, and we want you to join the conversation. Just use the hashtag #TheReveal on 11. For The Reveal, I'm Liz Crawford.
If you have a news tip or a comment on one of our investigations, email us at thereveal@11alive.com.
A gifted musician with grades that would make any parent proud.
He was accepted at Rice, UGA Honors.
Despite a world of opportunity, this student spent the past 2 years behind bars.
David fits a profile that many people are afraid of. He's male and on the autism spectrum.
Next week on The Reveal, David's family takes us inside their private pain, offering a rare look at what happens when a student is accused of writing a letter threatening to kill his teacher. This is a graphic letter.
It is a very graphic, it's an alarming letter.
Someone to fear, falsely accused, or simply misunderstood. That story next week on The Reveal.
You've been watching The Reveal, a show where news is made.
And we'll see you next week for The Reveal.